Howdy, cutie. So, basically, sorry to, like, bring you around to my apartment at such short notice, but, I just wanted to know, something. So, basically, tomorrow I am going to do a test at my med school, um, and basically I'm, like, pre pre-test studying um for this like mock examination thing uh where basically I am going to be doing a mock cranial nerve exam, and I just want to make sure that like my brain and memory is all up to scratch. So that's why I was wondering, since you're my like best friend and all, if you would be my sort of patient. Um, don't worry. Um, it's all going to be non-invasive, sort of easy tests. Nothing you probably haven't seen or experienced before. Um, does that sound good to you? Okay, perfect. Okay, so I will be totally honest. I don't really have a lot of the resources for it because that would be in the classroom. So I won't be able to do the visual stuff like a letter chart or like a pen light, whatever. I don't have access to really any of that in this apartment, but I should be able to provide most of the tests, hopefully. Okay, so I guess we could just sort of get started. So what's in my notes here? What's in my notes here? Alright. Use this. Cover one. Alright. So, first simple test. I'm going to take my finger out of your vision. So, like this. And I just want you to let me know when you can see my finger. Good. 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 Okay. Alright, so now I'm going to do the exact same thing, except I want you to look directly forward or directly at my nose or whatever works, really. Sorry. And I am going to take both of my fingers out your vision, but only bring one of them in. So it could either be the left side or the right side. And I want you to let me know what side you see come in first. Good. 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 Both. Good. Good. Okay. Perfect. Alright, continuing on with your eyes, I want you to just lock your head in place, look at the tip of my finger, and I just want you to follow it without moving your head. Alright, that was perfect. Alright, so this next nerve is sort of your face sensations. So this part of the exam I would need to touch your face. Is that okay? Awesome. Okay, so I just want you, so I'm going to put both sides of your forehead here. Does it feel mostly the same on both sides? Yeah? about the same. Alright. Cool. Let's see. Okay, so I'm going to touch your... So I want you to close your eyes. I'm going to touch your face in different parts with the tip of my finger, so just like that. And I just want you to let me know when you can feel something, okay? Good. 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 Great. Good. 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 Great. Good. Awesome. You're doing amazing. Good. 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 Alright. That was perfect. You did really well. Alright. So for this next bit, I'm going to sort of test your jaw muscles. So, yeah, so basically just clench your teeth. And I'm going to try and open your jaw. Do not let me open it, okay? Don't let me open it. Don't. Okay, good. Alright, alternatively, I'm going to ask you to open your mouth really wide. Don't let me close your jaw. 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 Nice, nice. Alright, so I'm going to test your different facial expressions, so just raise your eyebrows. Cool. Close your eyes really tight. Don't let me open your eyes. 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 Don't let me open them. Don't let me open them. Don't let me open them. Cool. Okay. Cool. Yep. Smile. Puff out your cheeks. And then frown. And then just show your teeth. Like bare them. Like grrr. Alright. So, yeah. What I was looking at there was sort of your responsiveness in your different muscles, and that both of your sides of your face were like looking about the same, so about the symmetry of different expressions. So there's no face drooping, there's no nothing going on in your face. As far as that goes, you're doing pretty good. Alright, so I'm gonna get on with some hearing tests. What I do have is a tuning fork, and that's what we're going to start with. Yeah, I really enjoyed the tuning fork as well. That's probably why I own it. Alright, so I'm going to hit the tuning fork. It's going to make a little ringing sound. It should hopefully not be uncomfortable to listen to or anything. If anything, it should be quite relaxing. So your job, I want you to listen to the sound and just basically tell me when you can't hear it anymore, when it's fully rung out. Alright, cool. Good. one last time here. Perfect. Alright. You did absolutely amazing. Well done, you superstar. Alright. So next, I'm going to whisper some random numbers into your ear, and on both sides, and I just want you to repeat those numbers back to me. Okay? 1, 7, 32, 4, 67, 142. Good. 49, 32, 78, 64, 92, 97, 128. Alright, nice. Alright, so the next thing I'm gonna test is your glossopharyngeal and vagus nerves, which is basically your nerves in your throat and voice. So for this, I just want you to open your mouth really wide, and then just go ah, ah, ah. Alright, good. Yeah, sorry, I was looking at the back of your throat there, making sure everything was moving well, the way it should be. So with that and your throat, does swallowing feel normal? Like, yeah, there's no pain or discomfort? Good. Okay. Something I also realized I forgot to ask during the visual test. I'm definitely gonna fail it. Was there any discomfort during the visual test, like following the finger? No? Okay, good. There was no discomfort or double vision or anything, really? All good? Hell yeah. Finally, I want to mess around with your hypoglossal nerve, which is your tongue. So, simple test. I just want you to stick your tongue out and try and keep it as still as possible. So if your tongue is normal, everything's up to code, then you should have no problem with this test. So yeah, just perfect. There we go. Still as a pill. Alright. I'm pretty sure that concludes everything. See? Done deal. Yeah, thank you. You really helped me out, considering I forgot most of it. But that just means I will be able to read up on it more and be extra ready for tomorrow. So, thank you so much, cutie. Yeah. I hope that helped you in some way. So, bye for now. Thanks for the help.